All right, everybody. Thank you for joining us tonight. My name is Karen Hurd, and we are here with author, research scientist, Professor Emeritus, Dr. Steve Chaney. Dr. Chaney has an extensive resume, a career spanning 40 years teaching. How many of you guys wish your physicians knew about nutrition? That's part of what Dr. Chaney tried to do, okay? He tried to teach medical students about nutrition. And he was also actively involved in cancer research, published, I think, almost 100 studies.
About 138.
That's quite a few studies. And for those of you that don't know, these kinds of studies are not done in a few weeks. The publication process is quite long, which is why they are so valuable. And that's extraordinary to have that many studies published. He lives with his wife in North Carolina and has recently authored the new book, Slaying the Supplement Myths. So we're here tonight to put to rest, hopefully, some myths for you, help you to be more savvy consumers. This is Dr. Chaney's second book. His first book came out earlier this year, was Slaying the Food Myths. So you see where we're going, right, guys? You see where we're going with this? For those of you that have not yet gotten this book, I would get it. Highlight the things that are the most important to you. He really goes into a lot of detail in some of the myths that you hear just all the time. And some of the newer ones, the table of contents, let me just give you a little bit of an overview. Lies of the food supplement industry, who knew? Methylated bees. Now that we even know about this, I mean, who could talk about methylated bees like years ago, right? But we're all savvy now. But is it a myth or is it a lie? What are quality controls? What is junk science? Supplements that are dangerous. And I think sometimes that's why your physician's a little hesitant to recommend things, is he or she doesn't always trust it either. And then the supplement myths themselves, study designs, nutrigenomics, I think I can pronounce that now, holistic supplementation, and more. There's just a ton of information in this book. We're only going to hit a few highlights. And so let's go to it. Thank you, Dr. Chaney, for joining us tonight.
You're welcome. I'm glad to be here.
It's great to have you. I wanted, some of the questions I have for Dr. Chaney tonight, gang, are not in the book. So, and some of them are. What we wanted to talk about.
I'm not telling you which are which, right?
Right? Yeah, that's right. So you have to get the book to figure it out yourself, okay? And then watch this many times. So we will do it. But I know that as a consumer, it's really tough, isn't it, to kind of figure it out. Does anybody whose supplement doesn't say they have studies? They all do. They all do. Even the ones that came out just last week. Sometimes you can put a supplement to market in like 6 weeks, right?
Right.
So even those have studies. So I think as consumers, we try to do our best. And it is really difficult to figure out what is who and who is what. So Dr. Chaney, if you could help us out understanding a foundation, a little bit of the research that all this kind of stuff is based on, and how is the research the same when they test for a drug, say like when they test for a supplement or a natural substance?
Okay, so lots of different questions interwoven there, but let's take the drug one first, and we can come back to some of the others, because now we're talking about human clinical trials.
Yes.
And not all of the studies that the supplement companies refer to are human clinical trials. Not all of them are well designed. We can go back into some of that detail. Let's talk about human clinical trials. So if you're testing a drug, that's the easiest of all human clinical trials, because everybody. Go ahead.
Why is that? Why is it easier?
Because everybody in your study group already has disease X, whatever that is. Or in some cases, they're at very high risk of coming down with disease X. And your drug is either going to reduce the symptoms or cure it. And it's a pretty simple yes or no answer.
Okay.
Now, when we talk about supplementation, there's a whole bunch of other things that come into play. And we have to understand there are different levels of clinical studies. So from the drug study, where everybody has a disease and you're testing a specific drug to see what it works with the symptoms or the cure, we go to what we call called secondary prevention studies. Secondary prevention studies are pretty close to drug studies in that everybody has a disease or at pretty high risk of the disease. And actually, when you look at supplements and those kinds of studies, they often do pretty well. But from there, we go to primary prevention studies. Now, primary prevention study is when you're just looking at a cross-section of healthy Americans. And now the problem is there are so few people in that study who will develop the disease within a reasonable period of time that it becomes almost impossible to show an effect. The example I give is statin drugs. So if you've already had a heart attack, you can absolutely show in multiple clinical studies that statin drugs dramatically reduce your risk of having a second heart attack. But when you go to a primary prevention type of study, it's almost impossible to show a benefit. And I go into much more detail in the book. So, you know, that doesn't mean there's no benefit there. It's just that it's become so difficult that statistically you have to have so many people. The study has to run so long to have enough people to develop the disease, develop a heart attack or heart disease that, you know, you can't really get the numbers to make it statistically significant. Now, cardiologists look at that and say, well, we know from secondary studies, secondary prevention studies, the statin drugs work very well. So we assume it'll work in the healthy American population who happen to have elevated cholesterol or diabetes or some other risk factor. So we're going to recommend it for everybody. I had a cardiologist lecture our first year medical students once that only half jokingly said that he thought we should put it in the drinking water. With such beneficial drug, we should just put it in the drinking water. And that's kind of the way some cardiologists look at it. On the other hand, we've got studies where you see we see an individual nutrient being effective in a secondary prevention setting. But if you can't show it in a primary prevention setting, we have the same people saying, well, it's really not worth it.
Okay.
It's really not doing it. You know, forget it. It's not proven to be effective.
Okay. And that's where some of the confusion comes in.
Absolutely.
And so that's where some people might say it might not even be worth the prevention because we don't know for sure.
Right. And that's where, and again, that's where I talk a little bit about bias. I know you wanted to talk about the pharmaceutical industry. And
yeah, let's pick that up a little bit because there are some, we'll talk to people, those of us who are in wellness education, and there seems to be a line of thought that the reason why certain information is not available about supplements or there's skepticism about medical professionals is because big pharma is playing a role in that. And I don't think that that's fully the case. What is your take on that?
Well, I think when we first were talking about, you were talking about big pharma suppressing the studies.
Yeah, that's how some people feel, yeah.
You know, it's not really that. Where big pharma, where they're most disingenuous is when they are trying to promote their own drugs. And they tend to hype the studies that show benefit and try and put under the rug the studies that don't show benefit. Been numerous examples of that. But when we talk about supplements, they don't actually manufacture supplements. So it's really sort of the pharmaceutical medical industry who really think of drugs as the first line of defense. They really want everybody taking drugs, and they don't want people taking supplements because then they might not be taking drugs. And the role that pharma plays in that is providing the physicians with all these drug samples they can give out, providing them with information on exactly how their drugs work and how beneficial they are. So they're influencing them that we really need drugs for their patients. And so then you get this bias.
Okay. So that actually makes a lot more sense. They're putting their best foot forward,
right?
Forgetting to tell you about this other stuff over here, which you might not ever need to know about.
Right.
So yeah, that makes a lot more sense with me. So we talked a little bit about that, and one of the things, because your book is really helpful for consumers, but we see a lot of consumers, we're overwhelmed with information. It's conflicting information. We talked about this in the interview with Slaying the Food Myths. But the problem, I think, with purchasing supplements or even knowing where to start, I just had somebody say to me, and she's a wellness professional, and she said, I don't even know where to start. And here's somebody who's in that environment, you know, for a living. Is how much research can consumers be reasonably expected to do? Because how many of you go to a manufacturer website and then you go online to check the reviews?
And
And
that's, yeah, and I understand that. It is very difficult to do. But, you know, this is our body that we're taking care of. And it's not like this is a potted plant. We're trying to figure out how best to water it. And if it dies, that's okay. We can get another one. This is our only body. So I think it's worthwhile taking some time to study what we're putting into our body and asking, is it really going to help us, or is it going to be of no use, or maybe even hurt us? So, you know, one of the things I really, you know, recommend that people do is, you know, ignore testimonials. The placebo effect is at least 50% for things like pain and energy levels and well-being and things like that. So ignore the testimonials. People say they've got magnificent results with certain disease going away, or that sort of thing. Remember, we're all individuals, and none of us are going to respond in exactly the same way. Just because they get a great result doesn't mean that you're going to get a great result. As a scientist, I like to look at clinical studies. And if it's proven in a clinical study, then yes, some, you know, testimonials are okay. But if it's just a testimonial, that might be the only person in a million who actually gets that result. And you don't know unless you've done clinical studies. So
whether or not that there's some real basis for that testimonial.
That's right.
Outside of that person's experience.
Okay. And then, you know, there's, you can get endorsements by pro athletes. That's really popular, particularly in sports nutrition, doctors, and, you know, these endorsements are bought and sold. You know, it's just a dollar amount to get an endorsement for a certain product. Yeah. You have to understand endorsements really don't mean much. You've got to really look for what's the science, try and find out a little bit about what the quality of the product is. And again, there's a lot of smoke and mirrors there as well.
All right, let's talk. So we're talking about science. I'm going to talk about a website, and then I want you to talk about what junk science is, because everybody is claiming studies, right? Is there a supplement company out there that's saying, nah, we just threw it together? No, they all researched heavily and did their due diligence and yada, yada, yada. And then you go to their websites and they say, we've been featured in 50 studies. This one product, 50 studies. And I'm thinking, that's an awful lot of studies. That's like beyond world class. So how does the consumer know when they're on a manufacturer website? How can they tell, Dr. Chaney, if they're not a scientist themselves?
Well, so one of the things you should ask is, well, where are the studies? The particular website, because you gave me the URL for the website, I looked on it. Sure enough, they said they had 50 studies, 25 more coming, but they didn't list a single study anywhere on the website. Well, actually, they did list one, but this is one that was a generic study for why that particular nutrient was beneficial. Really a American Heart Association recommendation for how much of that, you know, that's beneficial, how much people should be taking. And an outdated recommendation of that, but, you know, it had nothing to do with their supplement. So that's, first you have to say, where are the studies?
So they should be on their website, clearly identified, or at least be able to get access to them.
Yeah, I mean, otherwise you can certainly write or email the company and say, show me where your studies are. Give me a list of your studies. You said you had 50. What are they?
And how can somebody tell whether it was a human clinical trial? Because I remember one time when I began my journey, somebody said, they've all got studies. And like, or were they like 6 guys around the water cooler going, yeah, I feel better. They said, no, they're real studies. And I thought, well, I went to, I was going to be a med student. So I said, bring them on, I'll read them. And I couldn't get past like the summary. Okay, that's as far as I could get. I went, well, I guess these are real. So how does somebody who's like got 0 training and they get this reference, is there a keyword or something they can look for to say, that's a human clinical trial? At least let's look for that one.
Well, again, either in the title or the summary, the abstract, both of those are available online. So for any clinical study they list, if it doesn't say in the title, you can look at the abstract. And in the abstract, if it's done with cells, they will talk about the cells that it was done in. If it was done in animals, they will talk about the animals it was done in. If it was a human clinical trial, they'll talk about how they recruited how many people were in the study, how long the study ran, and that sort of thing.
Okay, so you look for the word people.
Yes, you're looking for people, subjects, participants, various other names, but that's all about people.
Okay, awesome. So, and where can somebody, you've often mentioned in your book, peer-reviewed journal research, and I know that somebody can also pretend it's a journal and it's really self-published and they can give it a journal-sounding name. Is there a good third-party reference where you might find something called peer-reviewed journals? Because most of us aren't going to know, we're not going to, that's not our environment. We're not going to know. So we appreciate knowing that we do peer-reviewed. Where do we find them?
So the peer-reviewed journals are listed by the National Library of Medicine at a website called PubMed. This is not Club Med, it's PubMed. You Google it, it'll come up first. It's easy to find.
It is. And and I've done some searching on there, and you can just do like your search term and then a little plus sign and then whatever your question is. And you'll get the listing at least. And then it's up to you. You got a night of reading ahead of you. So in your book, before we get to some of the myths that are, some of the myths on how they got started, you say ignore the hype, and yet sometimes we hear people have very deep and real changes that they can be very specific about. So how would you define hype versus an actual result or benefit? I would know if they're hearing one or the other.
As I said, there are a couple of problems with people talking about the great results they got. One is a placebo effect that I mentioned. And the other is they might be 1 in a million or 1 in 1,000. That because they got that result doesn't mean that you're going to get the same result. That's why I like to, if you see the same benefit in a published clinical study, something that actually shows up in PubMed, it's got people in it, and typically the more people, the longer, the better. If it's only got 3 people in it or 6, half a dozen people, it's probably not a very good study. But anyway, if it's a human clinical study and it shows that on the average, people who use that nutrient, take that nutrient or that particular supplement, get the same results, they'll say sure. And that becomes valid. Otherwise, it's just noise. You really need to ignore it.
And you really can't melt fat in 3 days, can you?
No.
Oh, okay. I'm just checking. Wasn't sure. I mean, technology advances, right? And speaking of technology advances, I think that's part of how myths get started. We're told, because for those of you guys that know, there's something called nanotechnology, and that's like almost like little robots about this length, about the width of a single human hair. I mean, they're that tiny. So why can't we put all our fruits and veggies in a capsule? I mean, if we can do that, go to the moon, surely we can do these other things. So how is it, Dr. Chaney, do you think that our expectations about technology influence what we in natural health?
Yeah, I mean, I think that I see where you're coming from with that question. Technology has advanced so far that when somebody says, a company says, oh, we've got a new technology, we've discovered that something that nobody else knows, so that's why our supplement is great. It is tempting to believe them. Again, I want to see the published clinical studies done with their product before I'm really going to accept that they found something that was better. And, you know, and the interesting thing is there's some of them, yes, they've got a new technology. Yes, they've got some published clinical studies that show that that technology works. Got to keep my microphone from slipping off here. But you know that it's, if you compare it with other supplements out there, turns out it's no better than supplement X or Y or Z. It's simply another way of getting to the same place.
Okay, that's a great distinction. I appreciate that. So one of the myths is that you can get all of your fruits and vegetables concentrated in a capsule. Why is that not true? Not possible?
Well, you know, I just, again, this is
And you
not,
dealt with that in your book.
yeah, this is not rocket science here. It's just common sense. You know, folic acid is one example I give. You know, you would take 4 cups of spinach to get the RDA for folic acid. You know, that's assuming you dried everything down and you know, into, so 4 cups of spinach, well, that's just the folic acid. That's just 1 capsule. That's just 1 nutrient. Start to do the math. Fruits and vegetables. You know, one of the things that we have a favorite, we have one that's advertised in the radio here. They've got, I think, 20 different fruits and vegetables in a single capsule, and starts out with oats. Well, you know, if you took a serving of oats, and oats are already dry, that's 28 grams. The capsule's half a gram. And then you know, then there was broccoli, and if you desiccated broccoli and dried it down to a powder, that would be 8 grams. But the capsule's half a gram. You know, you could go through all the others, but you start to see the impossibility of what they're claiming. So what they're doing is they're using small amounts of each of these fruit and vegetable powders. So yeah, they got a little bit of broccoli powder in there, they got a little bit of oat powder in there, they got a little bit of this powder, that powder, the other powder, but there's not enough in there to provide significant amounts of any nutrient, and certainly not the nutrients you would have expected to get if you had a serving of that particular, you know, compound, that particular food.
So just basic math and this crazy little thing called molecules. So how do some of these myths get started? You delineated 2 that I wanted to address. One was everybody's getting DNA testing now. So all of a sudden, supplements that people could take for decades, they suddenly cannot. And without a marked difference in health. So how did that particular one about the, and I always get the letters wrong, so you have to help me with this one. MTHR?
Methylene tetrahydrofolate reductase.
Yes, exactly this one, yes.
So anyway, that's an interesting one. And again, it kind of illustrates how we go from a single observation to, and what worked for a single patient, to something now that's become a whole field, a myth, and you know, and I think actually a lie at some point. But you know, this started with a physician who had a patient who wasn't responding well to folic acid, and so they did some DNA testing, and they found out that this person had a partial deficiency, not a complete deficiency, because nobody has a complete deficiency in this enzyme, but a partial deficiency in the methylene tetrahydrofolate reductase. And this doctor remembered just enough of their medical school metabolism course. They said, oh, that might be a problem. Now, we teach what I call metabolism light to medical students. We're not trying to turn them into biochemists. So he never got the whole picture, but just enough to say this might be a problem. And what you need that methylene tetrahydrofolate reductase for is to make methylfolate. So he said, oh, well, I'll just bypass that. I'll give this patient methylfolate. And that particular patient got better. Well, from that point on, he assumed that everybody with that deficiency needed methylfolate. But you know, he didn't do head-to-head tests and said, well, I give this patient with that deficiency in methylfolate, I give this one folic acid and see how they compare. He just started giving everybody methylfolate, wrote some blogs, wrote some papers, published a book, and now all of a sudden it came on the radar. And now we have these bloggers. There's some bloggers out there that are irresponsible. Some of them have doctors attached to their names. I won't name names here. But, you know, they're much more interested in how many readers they can get than they are in providing accurate information. Because, you know, it's the man bite dog story. It's the one the medical industry has been lying to you kind of story. These are the ones that get lots and lots of readers. So they said, well, all along we've been told folate's great for us, but look, it's really bad for us. But pretty soon this morphed into, oh, it doesn't matter whether you've got this methylene tetrahydrofolate deficiency or not. Everybody now should be getting methylfolate.
Right.
As I mentioned in the book, there have been clinical studies done where they actually did compare methylfolate to folic acid. Even in people with a methylene tetrahydrofolate deficiency, there was no difference. The folic acid still works because this is not a complete deficiency. You just need a little bit extra.
Okay. And so, but there's a whole industry spawned. And as I've said, news is not always about what's true, it's about what's different.
Right.
And so let's talk a little about another one that I'm seeing coming full circle now. It's coming back around again. And that is soy used to be such a healthy food. And then it became evil incarnate and, you know, capable of poisoning huge groups of populations. And then now it's coming back around almost in favor again. But how did the whole soy, because soy used to be thought of as very good, to help people protect against certain hormonal cancers like prostate, like breast, even some lung cancer. And then it became the demon, and they terrorized literally, I think, a generation of women away from an otherwise good substance, where they began to think that the phytoestrogens in plants were the equivalent of human estrogen, and they're not. They're far weaker than their birth control pills. So how did that whole thing get started?
Well, again, it's kind of the same sort of process, but this one started with actually an animal study. And it was an animal study in which they, and this was a mouse study, and these were very unusual mice. They had no immune system, and they had no ovaries. So again, this was a very, very artificial system. And under those conditions, and then they injected human breast cancer cells into the mouse.
That just seems like that wouldn't fit at all.
Right. But anyway,
breast cancer cells would be completely different than mouse cells, I would think.
That's right. So, then they, then they gave them soy phytoestrogens, and lo and behold, the breast cancer cells grew. So that's where the myth came from. And then it just sort of exploded, same sort of thing. Dr. Strangelove started writing blogs about, how bad soy was going to be for all women. It's going to cause breast cancer. That was followed up by other experiments with mice that were normal, except that they had a genetic mutation that made them susceptible to breast cancer. Because in a sense, it's just like human clinical studies. You've got to have enough animals that develop the breast cancer naturally in a reasonable period of time that you can conduct an experiment. And these animals, soy protected. And again, all the clinical studies that have been done since then, soy has either had no effect on breast cancer or it's been protected.
And yet, and their physicians are advising them to stay away from soy.
And again, if you go to reputable websites, places like the Mayo Clinic, National Institutes of Health, American Cancer Society, the advice is very different.
Yeah.
They're saying, you know, we see no reason to avoid soy. Because
Right.
they reckon, you know, they do their homework, they recognize good science. You just got to avoid Dr. Strangelove and his blogs.
But they're good marketers, Dr. Strangelove is, and he makes
Oh, yeah.
awesome social media memes. So how can you tell, we talked about junk science. So the mouse study there was clearly junk science. I don't know how many people would have read down through to figure out that it was basically a mutant mouse given cells that weren't even in the same biological class as the mouse. And then it was really like Frankenstein. So how can somebody then, so let's talk a little bit about holistic. You talk about holistic nutrition in your book, holistic supplementation specifically, because you dealt with food in your previous book. What do you mean by holistic supplementation?
Well, you know, the story I relate in the book when I kind of start that chapter is I talked about when I was a young biochemist. I, you know, been at UNC maybe 7 years, 10 years, but I went to an international cancer symposium, and the world expert on colon cancer was speaking. And he said, you know, I can absolutely prove that a diet that provides adequate calcium, adequate B vitamins, omega-3s, and fiber, plus exercise, plus weight reduction, you put all of those together, and you could substantially reduce the risk of colon cancer. But I can't prove that any of them by itself will reduce the risk of colon cancer. And to me, that was an epiphany. I said, well, what is the message that we as health professionals are giving to the public? Are we telling them what he said, that if you do all of these things, it dramatically reduces your risk of colon cancer? Or are we looking at each individual one and say, oh, don't worry about calcium. It doesn't reduce the risk. Don't worry about omega-3s. It doesn't reduce the risk, et cetera, et cetera. So that's, to me, that kind of set me on the path. And, you know, for those of you that follow my health tips from the professor, although I actually do have this also in the book. So I talk about calcium supplementation. You may have seen these recent studies where they looked at calcium supplementation in older people, and they couldn't show any effect on bone density or reduce fracture risk. So they said, well, you know, forget calcium supplementation. You don't need it. That's ignoring a basic fact. So we know that calcium is absolutely essential for bone formation. We've got to have enough. But we also know that vitamin D is absolutely essential for bone formation. We have to have enough. We know that exercise is absolutely essential for bone formation, maintaining bone health. The interesting third thing is that none of them are sufficient by themselves. So when you pick this apart and you say, we're just going to look and see if calcium makes a difference, and you're not including exercise and vitamin D, well, of course it doesn't work. If you just look at vitamin D and you're not including exercise and calcium, of course it doesn't work. You know, that's where holistic approaches are much more beneficial.
And I find that people will often say to me, well, I want to add one thing at a time. They feel that they're being very, they're trying to be careful. They're also trying to maybe eliminate waste. And, you know, so you could do one at a time. And I say, well, it's like the cards at a table, right? Your body knows how many cards each player needs. It's going to dole them out, so you've got to give it everything. And it's going to decide, depending on all the things that you've got on in your own life, where you need it. And if you can't do this one at a time thing. So what happens when somebody does like I don't know what the word would be. I call it an isolated nutrient. They just do, say, niacin, or they just do, say, vitamin C, or they just do, say, I don't know, pick one, anything. Can that harm them?
In some cases, yes. because you're actually, in some cases, you can actually be interfering with the absorption of other nutrients that have beneficial effects themselves. Particularly, for example, if you're doing just a pure, say, vitamin E, alpha tocopherol. Now,
Okay.
alpha tocopherol is natural, but if you're just using the pure alpha tocopherol and you don't have any of the other forms of vitamin E there, you're actually interfering with the absorption of those other forms.
Okay.
So the alpha tocopherol might reduce the risk of heart disease, but the gamma and delta tocopherol are the ones that are probably the most effective for reducing the risk of cancer.
Okay.
So that's just kind of one example. Too much of one B vitamin, because the B vitamins work together, they influence each other's metabolism. Again, you can throw your body out of balance. Too much zinc and you decrease your absorption of copper and vice versa.
So sometimes people want it seemingly simple, like just take this. And a lot of times that's what their physician will say. Well, you don't need all that. You just need this. And that sounds very reasonable. But the truth is, in real life, it doesn't work like that.
Right.
Okay, that's like saying, yeah, there's probably a lot of other examples that we could use. So
well, let me kind of,
sure.
I think people kind of need a guideline here to
Yeah.
put them on the right. And that's one of the things I really talk about at the end, towards the end of the book there. I have what's called a Venn diagram, which just means overlapping circles.
Right.
And so how do you know you need supplementation, or how do we know? So one is diet. If your diet is poor in any area, supplementation can fill the gap. So everybody understands that.
Mm-hmm.
The second is increased need. And that can be because you're pregnant, because you're lactating, because you're older, because you're exercising. Most of those are pretty well defined. Then there's genetic predisposition. Yeah, there it is.
Yep.
And there's a genetic predisposition. And we're just learning about that. And finally, there is disease. And if you have a disease or at high risk of disease, certain nutrient needs, but I shouldn't say they're increased, they just become more apparent. And that gets back to what I was talking about at the very beginning of the call, when I talked about secondary prevention versus primary prevention.
Mm-hmm.
So if you've got a disease and a particular nutrient is going to make a difference, in a study where you're looking at that nutrient is more likely to show an effect. If you're just looking at the whole general population, you don't see it. Now, that same nutrient is probably important for the general population, but you can't show it unless they have the disease. So, it's a little bit, we don't know for sure whether the diseases are increasing the need or whether it's easier to measure the need.
So you're not saying, we don't know really what it is, but the observation is you need more of blank.
Yeah.
Okay.
So,
and I've noticed that in my own life because I have a lot of allergies.
Mm-hmm.
So I just flat out need lots more than the average bear. Right. And if I take a small amount, and in fact, when I got started in a holistic lifestyle, I said, you need to take a lot more. And I thought, that's insane. And she said, no, not for you. You take more. So I did. And within 6 weeks, I was off all the medications I'd been on since I was a child, which blew me away. But it was like my body had this hierarchy. Now I don't need to take as much now,
mm-hmm.
but I can't take as little as other people. And that's where I tell people, you just got to kind of play with it a little bit.
And so you had kind of discussed that, and I guess the best way to do this, one of the things in the book, I discuss the diet part of it anyway. So what we know from USDA studies is that the average American is deficient or marginally deficient in a number of different nutrients. Most of those deficiencies we can correct with a multivitamin. So not just a vitamin, not just a niacin, not just a B complex, not just a vitamin C or vitamin E, but a multivitamin. That's a great base to start with. Mm-hmm. And there's actually a published clinical study that came out recently that showed that multivitamins do take care of most of the deficiencies due to poor diet. We're not talking about increased need or any of those other circles, but just the poor diet. But the calcium, magnesium, and vitamin D are often still a bit low. There's not enough of those in most multivitamins to make a difference. So we probably want to get extra of those in our diet. The other thing that's become increasingly clear is that most Americans really aren't getting enough of omega-3 fatty acids in their diet. So that's part of what I think should be the base for everybody. And we're learning so much about what the microbiome does for our gut bacteria. Talked about that in my first book, but because of that, I think we should be looking for probiotics as well. And that's kind of the base, really making sure we get that foundation. Then we can go from there. And part of it is just sort of seeing how you feel, which is what, you have to experiment a little bit because your body's going to be different from somebody else's.
And if you're not feeling well in some areas, after a healthy lifestyle, including supplementation, that might be taken care of. And you see that over, I'm just going to make something up. Your joints don't hurt as much anymore, but you still need a little extra help sleeping, just, and so now you're going to work a little towards that.
So, that's just so people know, for people who have bought my Slaying the Supplement in this book, in there I have a URL, a link to a website called A Design for Healthy Living, where you can download for free a guide that, this is not, I'm not trying to do DNA testing or anything like that, but if you've got a particular health concern, I summarize the information from both books in terms of, based on what we know about the science, these are the diets, these are the dietary changes, these are the foods, these are the supplements that are most likely to be beneficial for that particular health concern.
That's awesome. And that gives people a really good help because I think, because I've had people say, well, how do I know? And I say, well, your health is like a puzzle. So it's like you get all the pieces in and then you see that one missing piece. You think, oh, that was the only piece I need. No, if you didn't have all the other pieces put together, you wouldn't have noticed that one.
Right.
So, and then we also wanted to encourage people who are concerned about either refining what they're doing or starting on a good program. We offer a health assessment. It has just 20 questions, takes just a few minutes to do. And I think you're aware of this particular assessment, Dr. Chaney. What do you think of it?
Oh, it's a very good assessment. It is amazing how much information you can get out of 20 questions. And what I like is that they weren't just trying to hawk their products. They weren't just trying to twist it around so that, it was just based on stuff that they said. This is all taken off of the NIH, the American Heart Association, Mayo Clinic recommendations, these sorts of things. So these are sort of way out kind of recommendations. The thing I like about it is if you take the time to kind of work your way through the results, you get a very rich, a lot of rich information in terms of diet. What are the changes in your diet that you can make that would improve your health, help you reach your health goals? Also in terms of lifestyle, what are the lifestyle changes that you could make? And then they do make recommendations for supplementation, which I think are a great starting point.
Yeah. It helps to narrow it down. So what we're going to do for everybody that's watching this webinar, I do want you to get Dr. Chaney's book. I really think it's an important book. We just like slightly scratched the surface of all the information. It's almost like he went through all the headlines and said, okay, about that. And it's in here. The whole red yeast, yes. That whole thing, the whole red yeast thing, the whole, the fruits and veggies, the whole calcium controversy, the whole omega thing, because part of it too, as you guys know, if you've listened to either Dr. Chaney or myself enough, is that we know that these controversies, I don't know, Dr. Chaney, how many controversies have you watched over the years, right? The new supplement that came on, and I remember when I first got started, it was a supplement came on and there was a cassette tape, Dead Doctors Don't Lie, that went around, and I thought, holy cow, I've missed them up. I was brand new, and then that stuff just all disappeared. It vaporized.
It turned out it was toxic, but yes.
Yeah, it turned out it was toxic. Turned out it was going to be really bad. And there were physicians marketing that stuff. So your physician doesn't always know either how to evaluate supplements. So this is where we can give everybody that good information. So what we're going to do, like I said, is reach out to us. You can either message us on Facebook. If you're in the group, you can just say me, I'd like one, and or reach out to the person through email or text who invited you to this webinar, and we'll be happy to get that. There is no charge for that assessment at all. And then when you get the book, you'll get the cool URL to the book that Dr. Chaney has. I just found it and downloaded it, and it's very good. A lot of times when people put out ebooks, it's just, they just throw stuff together to get a name, but it is real information in there because Dr. Chaney really does good stuff. We really appreciate you being on with us again tonight. We're so grateful. I know that you're busy. You guys are getting ready for the holidays. But thank you again for everything that you've done to help educate us be better consumers for our own health.
You're very welcome, and I enjoyed being on it. Everybody have a wonderful, blessed Thanksgiving.
All right. Thank you, Dr. Chaney.